Can you hear it? Are you listening? Ovarian cancer whispers, so women must be listening. In a world that is so eager to find cures for common cancers and ailments like breast cancer and lung cancer, ovarian cancer is not as talked about. However, is potentially one of the more lethal cancers around. Ovarian cancer consists of malignant tumors that reside in the ovaries. Being fully knowledgeable on ovarian cancer will give you and the ones you love a greater insight and hopefully a better chance at combating it. Whether you are a woman or have a mother, sister, wife, or daughter, it is important to know that ovarian cancer poses a huge threat. Once you are aware of the signs and symptoms as well as treatments of this cancer, you can be better in tune with your body and educate those around you. This interests me because my mother was diagnosed with ovarian cancer in 2000, and she succumbed to the disease in 2004. I have been determined to be knowledgeable about ovarian cancer and to spread the word as well. By being aware of the signs and symptoms, diagnosis, treatments, and statistics of ovarian cancer, an individual is likely to have a better chance of remission and catching it before it advances. The most important aspect of ovarian cancer is knowing the signs and symptoms it presents and how it is diagnosed. It is vital to know the signs and symptoms and can be easy to ignore. The American Cancer Society mentions these in particular symptoms: abdominal issues, swollen, bloated abdomen, change in bowel movements, female-related problems like unexplained vaginal bleeding, and pressure or pain in the pelvic area. For diagnosis, there are two types of ovarian cancer. There's germ cell or stromal cell, or stromal tumors or epithelial cell, and they're staged 1 through 4. The earliest detection is 1, 4 is the latest detection and the most advanced. In these 1 to 4 stages, there are substages A through C, and it depends on the manifestation of the tumors in the cells. If a tumor is metastatic, it means the cancer has spread to other parts of the body. However, if there's recurrence, that means it was once gone and now it is back. There are many different types of diagnosis. You can be a physical exam, CT scan, PET scan, MRI scan, biopsy, and blood tests. It's always good to get one of these done if you ever feel uncomfortable or have any of these signs or symptoms. Not only is awareness of the signs and symptoms vital, it is also important to understand the treatment and healing of ovarian cancer. There are many different types of treatment and healing that can be offered to a woman with ovarian cancer. According to Johns Hopkins Ovarian Cancer Center, there are 3 types of medical treatments. This includes surgery, chemotherapy, and radiation. Surgery is the removal of the malignant tumors. I'll read that quick, and I'm going to put it down and continue talking. I will also post this on my posting. It's the removal of malignant tumors. A salpingo-oophorectomy is the removal of the ovary and fallopian tube, while a hysterectomy is the removal of the ovaries, fallopian tube, and uterus. Chemotherapy, there are 2 types. It's adjuvant or neoadjuvant. The types depend on the stage of cancer and how advanced you are. Beyond that, there's radiation, which is the use of X-rays to destroy the cancerous cells. It is not applicable if the cancer is confined only to a small area. Another one that many people usually don't think about is nutrition and exercise. It helps keep the immune system strong and the body strong, and if you eat right and keep yourself active, you're going to have a better chance at fighting this cancer off just in general. Now that you know exactly what ovarian cancer consists of, it's important to recognize the statistics involving the disease. Knowing the risks and statistics involved in ovarian cancer are helpful in a woman's diligence and awareness. According to the Ovarian Cancer National Alliance, only about 15% of ovarian cancer patients are diagnosed at an early age. This is because it's difficult to diagnose. The median age for a woman to develop ovarian cancer is 55 to 64 years. And there's a significantly lower survival rate than other cancers affecting women, like breast. A woman's lifetime risk of developing ovarian cancer is 1 in 75 women. However, the woman's lifetime risk of dying from ovarian cancer is 1 in 100. And there's a 5-year survival rate of 45.6%. You can now be confident in your knowledge of ovarian cancer. The signs and symptoms it presents can easily be overlooked. Once ovarian cancer is properly diagnosed, the treatments involved can vary. The statistics of the deadly disease are not extraordinary, which means diligence is key. A woman that is in tune with her body is essential for early detection and diagnosis.